Somewhere in your medical practice right now, a perfectly valid medical claim is sitting dead in a denial queue. It is stuck there for a simple reason. A patient's Medicare Beneficiary Identifier, or MBI, is missing, mistyped, or outdated. When that claim hits the payer, it triggers a very specific sequence of errors. You get hit with reason code 16, paired with remark codes MA27 and N382. This is a hard denial. The MBI is an 11-character string with no built-in logic. If a single character is off, the system shuts down the transaction entirely. The money stops moving until a human being digs through a portal, finds the right alphanumeric string, and forces the claim through. A single data entry error at the front desk locks up your revenue indefinitely. With 67 million Americans enrolled in Medicare, MBI friction is a mathematical certainty for any outpatient practice. This chart maps the rising volume of provider denials, revealing a critical threshold. Right now, 41% of providers face denial rates at or above 10%. Underneath this is a collapsing workforce, with business operations turnover exceeding 30%. Every time a frontline support staff member walks out the door, it costs an estimated $30,000 in recruiting, onboarding, and lost productivity. Practices are caught in a vice. They are losing valid Medicare revenue to unpaid claims on one side and burning their operating capital trying to hire enough people to fix those claims on the other. The breakdown usually happens like this. An elderly patient arrives at a busy front desk but forgets their Medicare card. A stressed staff member guesses, pulls an old number from a past visit, and checks them in. When that guess fails, the back-end cleanup takes over 10 minutes per claim. Someone has to log in to fragmented MAC portals, run manual eligibility rechecks, and navigate different jurisdictions just to find the right identifier. Top-performing practices do not rely on patients to preside their MBI verbally. They build dedicated, real-time verification workflows that pull the correct MBI directly into their system before a claim is ever submitted. They also build reissuance detection into their daily protocols. If a patient reports a card lost or stolen and receives a new identifier, the practice's system instantly detects the change. Relying strictly on front desk guesswork guarantees inevitable write-offs. Securing revenue requires a proactive management system that catches MBI errors before they trigger a denial. Building that proactive system in-house is expensive, which is why smart practices remove the MBI queue from their front desk entirely. They outsource it to a dedicated team working directly inside the practice's own EMR. The specialists managing these queues hold AAPC and AHIMA credentials. They understand clinical coding, modifiers, and exactly how an identifier mismatch impacts the back end of an explanation of benefits. This digital logic tree illustrates how artificial intelligence accelerates their workflow. The AI automatically routes the lookup queue, pushing claims nearing their timely filing window to the very top. While the team works, automated background audits run continuously, flagging anomalies and predicting likely denials before a claim even leaves the system. Combining credentialed human expertise with precise AI-driven workload routing transforms a chaotic manual chore into a precision operation that stops revenue leaks. The financial logic is straightforward. Hiring an in-house billing specialist costs up to $75,000 a year once you factor in salary, benefits, payroll taxes, and the inevitable cost of replacing them. This side-by-side visualization shows the alternative. Staffingly provides a dedicated specialist seat for $399 per week. That structure eliminates your training overhead, your benefits load, and your turnover costs. The operation is secure and highly accurate. The service runs under strict SOC Type 2 compliance. Every team member is HIPAA trained, and the error rate stays below 1%. There are no long-term contracts to sign. Practices are fully operational within 14 days, moving month to month after a rapid pilot that integrates right into your existing EMR. Protecting your practice's margins means you have to stop the silent leak of MBI denials. Staffingly provides the operational model to do exactly that. Visit staffingly.com/demo or call 800-489-5877 to launch your pilot today.